Right. Hi there, everyone. In this video, we're going to be discussing moral distress. Now, moral distress is common in medicine and in healthcare, and some have described it as inevitable. But what exactly is moral distress? Well, moral distress is an unpleasant psychological or emotional reaction to a moral conflict. Well, that's all well and good. What's a moral conflict? Moral conflict is when you are not able to do what you feel is correct. And this can manifest in a few different ways. Moral conflict is naturally a quite personal thing, right? It depends on your values, it depends on your own ethical, moral code, right? Moral conflict can occur when there are two equally morally correct paths that you want to follow, but you're only able to follow one. A very common example in medicine and in healthcare occurs when we have patient autonomy conflicting with beneficence. So beneficence, we want to do the best for our patients, right? We want to do what is right for them, what is good for them. On the flip side, we have patient autonomy, where patients have the choice, have the say for what happens to them. And sometimes these can be in conflict, right? What we perceive is going to be best for the patient may not be what the patient wants. And this is a moral conflict that can lead to moral distress. Another example of moral conflict can occur when what you feel is right and what you feel is the morally correct thing to do conflicts with government policy, institutional policy, hospital policy, your boss's policy, and these external constraints prevent you in your role, in your job, from doing what you feel is correct. So there's a number of different kinds of moral conflicts out there, and many of you watching this video probably have some coming to mind. Now, moral conflict can lead to moral distress, although not all moral conflicts will lead to moral distress. So what exactly does moral distress feel like? There's a number of different symptoms out there. Some of the more common ones are frustration or anger, particularly if this is a moral value that's very important to you. The situation hits very close to home. You may feel, seething, overwhelming rage, right? A sense of powerlessness or helplessness, even hopelessness, depending on the situation. You may feel tired. You may feel sad. You may feel like withdrawing from others or withdrawing from the situation. Moral distress is also associated with a number of physical and mental health concerns, including burnout, that deep physical, mental, and emotional exhaustion that is also, unfortunately, very common in the medical field. So what can we do about moral distress? I mentioned before that it's very common. Some have described it even as inevitable. Well, in the literature, one of the things that's been found to be most helpful is speaking with others. Whether this is a mentor or a peer, some of your friends, your co-workers, anyone around you, right, that you feel able to speak to, open up to a little bit. Because what we'll often find is the things that are bothering us and the things we're going through, we're not alone in that, right? Many of the situations that touch us are common across medical fields or across different groups of healthcare workers, right? Sometimes speaking to someone else can help you put things in perspective, help you work through things that are bothering you. It can also be helpful for someone just to say, I've also felt that, or I also feel that way, right? That can be very validating. So that in a nutshell is moral distress, and I hope you found this video helpful.